Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Hello, everyone. Welcome to another episode of the Dental Brief. We are back from Thanksgiving vacation, and we have with us a very terrific guest, either been on the show 4 or 5 times. We'll have to look that up in a little bit. Brandi Hooker Evans, say hello.
What's up, Patrick and the Dental Brief peeps? How are you?
Hey, I'm fantastic, and you're up, and we're excited to have you here. Always high energy. We love having dentists on the program. We love having hygienists on the program. So we're just thankful to have you here and thankful for what you're going to share today. Why don't we just kind of jump right in? You're busy. People. I'm sure someone has heard you on the program before. How long have you been a hygienist for?
Since 2007. So this is my 15th year.
Yeah. So you've got some experience under your belt, if you will. And you also do quite a bit of speaking and work with coaching and working with teams across the country, right?
Absolutely. Yeah.
How'd you make the jump from working in a practice to consulting and speaking?
Well, I was getting ready to move towns. I was excited to go home for a while, if you will, move back across the state. And I had the most incredible clinical job that you could ever imagine, plus a handful of amazing gifts or experience with the leadership of the Hygiene Association. And I had experience with teaching at the university, and I had a lot of patients that I failed with and a lot that I'd succeeded with. And I felt like I had this huge soup pot of goodness that I had to figure out what to do with, because I believed that God in the universe was calling me to serve our profession and our patients in a greater way, because to whom much is given, much is expected and all that. So through endless conversations, through anyone that would chat with me, I came up with the fact that I wanted to coach other teams so that I could give them the things that I've failed at and the things that I had succeeded with, and help them have better careers and take incredible care of their patients. So that's the short version of that story.
Yeah, and so here you are. Let's jump right into kind of today's topic. So you're working with teams, you're coaching teams out there. What are some of the things that you're hearing from them? What are some of the challenges that you're helping them overcome?
Typically, as dentists, dental hygienists, and the entire team of assistants and front office extraordinaires, we think that our patients don't care about their oral health. We think they don't have enough money for their oral health. We think that they don't have time and energy for their oral health. So we make a ton of assumptions before they even walk in the door. We just assume that we have to be so grateful that they're there, take care of them as fast as we can, and try not to upset them in any way, shape, or form. And then we cross our fingers and hope that they're going to show up next time, first of all, and second of all, healthier and doing what we're asking. But there's some gaps in there, Patrick.
Yeah, there's some big gaps in there. And I think let's talk a little bit about assuming, right? Assuming what the patient's thinking or what they're going through. I always think it's a bad idea to think for the patient, to try to decide what they're going to say, what they think, what they're feeling, who they're going to share it with before you even talk to them. I think that's a pretty common thing that people do. It's not just in dentistry. It happens all over the planet where people make assumptions based on whatever, right? It's that old saying, don't judge a book by the cover. How often does that happen in dentistry? And how do we get by that? First of all, let's talk about the dangers of doing that. Why shouldn't we be thinking for the patients?
Because we honestly have no idea what they're coming to this appointment with. We don't know their history. We don't know their hopes and dreams. And we don't know their education level. I do have patients that are what I would consider to be educated in a way that they have decided that they just don't care about their health, period. I have a couple of those. Those are the exception, though, not the rule. What I learned and have collectively, I say I mean myself, my colleagues, the people that I've worked with, right? This is all one big lab experiment. What I have learned is that when people are given simple enough information to understand and they don't feel like they're being attacked, they actually do care about their oral health and their overall health. They're just overwhelmed and they don't know what to do.
Makes a ton of sense to me. So when you talk about they don't understand how relatable oral health is to their overall health, what are some ways that you can change that? What can you do to help a patient without shoving it down their mouth, so to speak? What are some things that we can do to change that?
So first, I always go with the KISS rule. Keep it simple, stupid, or keep it simple, silly, depending on how politically correct you're feeling on this Monday morning. And I take the patients, we are going to take the patients through their assessment, but keep it really simple. For example, when we're looking at x-rays, their bone in between their teeth is a thick white line that should go up, over, and down the dense corticobone that shows that there's not infection creeping into permanent damage status. So if you say, okay, do you see this thick white line? It should go up, over, and down. The patient can look at the picture, look for that trigger, and be able to say, oh, no, my thick white line goes up and then is super fuzzy. Or it's not as high as it is on this other tooth where it's healthy. And so the patient decides for themselves, like, oh, there's something going on. And obviously we've got verbiage for all of the assessment with that, like 1 to 3 millimeters is normal, and healthy gums don't bleed or hurt while I'm measuring. So by the time you get done measuring their gums out loud, the patient's already decided that there is gum disease there because we gave them the tools that they need that were simple enough to understand, quick and easy enough to achieve that diagnosis on their own. That way the dentist and the dental hygienist job is to reinforce, like, hey, this is true. You're right. There is infection here. And then get excited about what we can do about it. I hear all the time dentists and dental hygienists like wagging their finger, and I used to do it too. Oh, if this isn't better, we're going to have to do scaling and root planing, or we're going to have to do a filling. Like it's a bad thing. Patrick, do you know how freaking cool it is that we can do scaling and root planing? How amazing is it that we can remove decay from a tooth and put in a material that is going to prevent the decay from growing deeper down into the nerve of the tooth and preserve that tooth for potentially decades?
Yeah, it's fantastic, especially when you present it that way, right? Which I don't think a lot of people do, and that's why we're talking about it. I mean, you present it in a way that sounds like it's a really good thing. I've heard it presented in a way that scares me to death, being in the patient chair, right? On that side of things, because it doesn't sound that good when you talk about scaling and root planing. It just doesn't. So I think that's a fantastic way to do that. What about starting with talking to the patient about the percentage of people that has some type of periodontal disease, right? So, like, does that make sense to do?
Yeah, I think that it is good a little bit further in the conversation. First of all, people care mostly just about themselves. I know that sounds terrible, but let's just call a spade a spade. People want to know what's in it for them.
Of course.
So first, we get them to decide for themselves, like, hey, I've got something going on that I need help with. Then the second thing is people start to feel worried or embarrassed, like it is a bad thing. And that's where the conversation you're talking about comes in. Someone's like, oh man, this sucks. Am I just dirty? Am I doing something bad? And the answer is no, actually, this is a really common infection to struggle with. About half of all adult Americans have periodontitis. And then when they get older, 3/4 of them. So you're not alone in this. But we've got to get a plan today. And the great news is this: you and I are partners. We're going to link arms. I'm going to do some cool stuff here. You're going to do some cool stuff at home. And we're going to move forward together as a team. People are excited about it. And guess who has time, money, energy, and plaque removal skills all day long once the conversation sounds like it's understandable, it's fun, and it's doable.
Right. Yeah, and you mentioned before talking about education. I think we assume it's really easy for us to assume people that are highly intelligent, or we know they're highly intelligent. For instance, if you have a physician in your chair, right, it's probably think, oh, this person's very intelligent. And of course, they are very intelligent, but it doesn't mean they're very smart when it comes to these types of things, correct? Like this isn't something that they're focused in on, especially when you look at physicians. I was just on the phone with one a little bit ago that are specialized. Anything outside of their specialty, they don't understand at all, right? Because they're kind of laser beams focused in on what they do. And I think that's a mistake that we make. We think that someone, maybe they have a blue collar job and we assume they're not, PhD level intelligence, but they're very smart people that are very educated and do understand these things. So I think it is a mistake, again, going back to assumptions, trying to guess who knows what. Right, keeping it simple and stupid. I prefer that variation myself. So give me 3 steps. 3 steps a practice can do today. Of course, they can reach out to you. BrandiHookerEvans.com, if I remember correctly, is your website, right?
Yeah, for sure.
Reach out to you, right? Get some coaching, dive a little deeper, of course. But what are 3 practical steps a practice can take today to get better at their case acceptance when it comes to periodontal disease?
Perfect. So the first thing is to never skip assessment. Just trust me on this. Even though it takes a minute, it opens up a tremendous opportunity for you to take incredible care of your patient. So don't skip assessment. Number 2, keep all explanations as simple as you possibly can. For example, don't tell them about the dense cortico bone. It's a thick white line. And I'm not dumbing it down. Like what you said, the laser beam focus and the amount of education that goes into knowing everything about everything is overwhelming. My friends, It is not dumbing it down. It's being kind because we're clear. All you Brene Brown fans out there know that kindness is clear. So the third thing is to show them their own assessment. So we're building this situation where the patient knows what's going on and isn't having to dream the connection between a cool flip chart that a toothpaste company made and what's happening in their mouth. Show them their own blood pressure reading, x-rays, perio chart, all of it. That way it's real for them. They understand what's going on. It's not a foreign concept in a foreign page or on someone else's life. This is their mouth. They have bleeding, they have bone loss, and so freaking cool. We can do scaling and root planing, and then we can talk about how to reduce inflammation in their whole body and how attacking their oral health with some vigor and excitement is not only going to benefit their mouth and their breath, but it's going to help them live a healthier, happier, longer life here on this planet, because oral health is connected to overall health.
Yeah, and how does that feel? Tell me real quickly, we talk about just how does it feel? How does it feel when a patient gets it and that you have that experience with them? What kind of job satisfaction do you think it brings to yourself and everyone else on your team?
Oh my God, Patrick, it makes me over the moon. Like, you can see me. I know the podcasters can't see, but I am like talking with big hands and I'm overwhelmed with joy. I am beaming because I'm making a difference. We together are making a difference, and that feels so good. You have energy for your patients before lunch and after lunch. You're excited at the end of the day to go home and spend time on your hobbies or your family or what have you, because instead of beating your head against the wall with patients that don't care, you are linked arm in arm with patients that you love, that love you, and are ready for this next chapter to be the best one yet.
Yeah, and I want to encourage our audience. I want to thank you so much for coming on. It's great information. So helpful for our listeners, and I think some steps that they can certainly take today. I definitely encourage our listeners, if they want more help, to reach out to you. It's Brandi with an I, HookerEvans.com. Fantastic website. It's free to download. Worksheet you can grab right on the homepage, so take advantage of that. And thank you, Brandi. We're so thankful and grateful to have you here.
Likewise, Patrick. Thanks for serving our profession and being a great friend. Good to see you.
Thank you.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.